talking about now is health insurance, because if you get your health insurance through the MNsure exchange, prepare potentially for higher costs. Proposed increases now from Minnesota health insurance companies, maybe 10% or more for next year, on top of some increases last year. These will be finalized later in the year, in the fall. But joining me now to talk more about this and the trends here, what we're looking at, Julia Dreyer, the Deputy Commissioner for Insurance at the Minnesota Department of Commerce. Julia, thanks for being with us.
Well, thanks for having me.
What is the first things that people need to know about, again, that these are proposed rate increases from, let's see, how many different insurers are on the, are taking part right now, and what these rate increases proposals are at this point?
Yes. So every year, companies that sell insurance to be sold on MNsure, or so if you're buying insurance on your own, they submit rates to the Department of Commerce to review to make sure that those rates are supported by data and that they comply with any applicable state and federal laws. So this year we have 5 companies that will be selling coverage on MNsure, or proposing to sell coverage on MNsure, and they've submitted those rates to us. They range from about a 10% increase to about a 13% average increase.
And this follows some increases from last year, correct? Are they sort of on the same trend, or is it larger increases than what we saw?
Last year we had really significant increases. We had, high 20s, 30% increases. This year we're looking again at like between 10 and 13%. So it's still challenging for Minnesotans, right? Like, the economy's tough for a lot of people, and so this just adds to that pressure. But it's certainly not as bad as we saw last year.
Yeah, I mean, and obviously, I mean, this is where people are trying to get some affordable health insurance, and so you hate to see rate hikes, but you would imagine that these are trends across the health insurance industry based on other costs going up. I mean, what do you see as the factors driving some of these proposed rate increases?
Sure. Well, we're still reviewing. Something we're doing over the summer is looking at increases to understand what is driving those costs. That said, we do know that in general, health insurance costs or rates are increasing because the cost of care is increasing. So it's more expensive to go to the doctor, to pay for those prescription drugs. People are using more healthcare. All of that contributes to those increases.
Yeah, and I know some of the things that I've read, we're looking at various things like prescription costs are going higher. Some other medical, whether it's testing or procedures, et cetera, that those costs continue to rise as well.
Absolutely.
Yeah. So what happens between now and this fall before these rate changes are, have to be reviewed and approved and finalized?
That's essentially what we're doing. So we are reviewing all of the actuarial tables. So looking at all that math that insurance companies are using to make sure that their math checks out, and to make sure that all of their policy forms are meeting all of the new federal and state laws, as well as any other laws that may apply to those companies. So really, that is what our team is doing over the next couple months.
All right. Any advice to people who use the MNsure marketplace to get their insurance, who are looking at these proposed hikes, about reviewing their plans, or maybe whether they want to switch it or go to a different insurer? I mean, what should people be doing now over the next few months?
Yeah, that's a great question. So I think the important thing is rates aren't what people end up paying. So it's really important for everyone to go, if you are buying insurance on your own, so if you are buying insurance through MNsure, that you should go back and check and see what any tax credits you might be eligible for. It always helps to shop around and just make sure you're getting a plan that works well for you. If you need help, MNsure has lists of navigators and can make some suggestions of people to talk to provide you some advice on what you may need to adjust in terms of insurance.
Are any other potential changes on the horizon for MNsure that people should be aware of?
At this point, we're really, every year there may be additional changes that sort of pop
minor
up
modifications here and there. Yeah.
But at this point, we're not expecting any significant changes. People really should just go in and check and make sure that they are able to purchase what they need to purchase or want to purchase.
Okay. And again, the date for the then rates to be finalized, is it the beginning of October?
Rates need to be finalized by October 1st.
Yeah. All right. Julia Dreyer, Deputy Commissioner with the Department of Commerce for Insurance. Thank you. Certainly affects a lot of people. Luckily, they have a little time as you review these rates to kind of look at their own options.
Yeah, absolutely.
All right. Appreciate the time. Thanks so much.
Thanks.